meghalayapost.news.
Kalapan Kmen ikipat ba kaput kibasong hagi Shnong repair jongatan Rani Bari pat kata gadai hadian ba mentagasngi ba sustenance certain MLA Jirang ulalai ban plepat ba ya ke Rani Bari sub center kemudian hapok ke Shnong Rani Bari kemudian ke Shnong ke bahap Jirang blok ketika Rani Bari sub center kan saajing mentoi ikipat ba hagi kad arti lagi Shnong Khappud kibadan hagatan Rani Bari nama lingba ketika sub center kipat ba kibasong ketika tan kinsuk aba kilit syak sumar haga por bagi pang bastom bat kiblalet ban syak sumar shado war bau saw ni shadu patar khma baru banlet syak sumar hagi jaka sumar ki badan ha kaliang Assam habapli ya ketika sub center la sakhi langru daga jingadon lang ke kong birani ADC griboy kum kesembut kongsan AR marak DMHO riboy ke doktor ke lingdo medical officer ke patar khma CHC ki he na karuna trust ki ramba Shnong kathain Rani Bari lem bagi pajba nong Shnong ha kathain Rani Bari hi barokawai habakren ha ketika jingpli ya ketika sub center ba sustenance ulong ba Kmen ba layo ban pen ulong ya ketika jing angnot ke bala slem namar ya ketika sub center kadai ke bala angnot nadu ke por ba yakun ha election ar jakat pra ha ka ba ula kula rakmat ki pajba jong ketika than bala dakin penjob yu kum MLA unsa penyo ba ya ke wai ke sub center hapo ketika than.
And sir, it is indeed with great appreciation that we express here today along with the entire people present here that it takes dedication, perseverance and hard work from your part to see the realization of this dream. So the people and all present here, including my colleague here who is also Assistant Commissioner, let's give sir first of all a round of applause for his personal intervention in seeing that this happens today. So as we all know, as sir has already told us that this has been a long-awaited dream for the community. And as we see here today, we can see the participation of the youth, the beautiful song that just presented. So I think that we know the importance of this day because one of the ambition or one of the objective of having a PHC is to have a closer interaction, a closer relationship with the people. And in the Indian healthcare system, we know that these kinds of health centers have served the public. We know that they are the first step or the first step towards providing healthcare, primary healthcare to the public. And we can see that this day has come, and the people, I hope, we will be like the chairperson has indeed highlighted. This is not just for the medical officers, for the medical team who are running this healthcare center. It also belongs to the community because it is actually the first point of contact. It will help people overcome very minor health problems that we find that they experience in their day-to-day daily life. Then we also know that such health centers also form as a school of reforms or as a training ground or as a behavioral change center towards the people, towards the attitude towards health. So I believe that all of us present here have a very definite, specific purpose to ensure that the center, the health facility is run with dedication and also with a deep personal care towards the community.
During the election campaign, all our leaders that are here, I hope they still remember that we kept this Rani Bari sub-center as one of the main election campaign to complete. And today I'm very happy, and I would like to thank the NPP-led government under the leadership of Sir Conrad K. Sangma and Madam Dr. Ampreen Lingdo, who is the Health Minister. It is because of the leadership who knew each and every area, the needs of the people, be it health or be it the other departments, the PHC, the PWD, or any other departments, this government under the leadership of our Honorable Chief Minister, Sir Conrad K. Sangma, has done lots of development for the state of Meghalaya, especially for Jirang constituency. That's why we gathered here today with happiness, joy, together with the health department, to see that this building, this permanent building, just constructed right in the border with Assam. And I would like to tell in front of you all, my dear friends, sometimes you will see in the comments, you will see that certain people will say that this government has done nothing for the people who are residing in the border. This is wrong. I'll tell you. This is wrong. The NPP-led government, if we go, we take to roads, PWD, we take to health sector, water resource, PHE, sports, it has done a lot of development, especially with the border areas. Building is yours. This belongs to the people of border areas. And we have a very big area, and I hope that in future we can get easily for the expansion of this sub-center into a CHC or to many other expansion if needs to in the future. So I would like to request to the people who are residing in the border, be friends, make use, be friends with the doctors, with the medical officers who will be looking under this sub-center. And you have to also take the benefits which you are going to get from this sub-center. The government initiatives, plans and programs is to bring a better health care for the people of the state.
MeghalayaPost.news